From the Marquee Media Studio inside Mark Tank, it's the Mark Haney Show.
Yes, we are on a mission to ignite the entrepreneurial revolution right here in the hometown we love. This show, it's about entrepreneurship, but it's about winning. And in winning, we typically need to be at our very best. So I am in this continuous exploration about how to unleash full potential or to be at your very best, at our very best. And today on the show, we're going to be exploring a newer approach in healthcare that can get us thinking more clearly. And so many of us have these barriers in our life that can cause depression, or even for a lot of us, maybe just not being at your very best. Well, today we're going to share the story about two women that have built a business around the use of ketamine and other holistic approaches to helping their patients and their clients to get back on track. So we have a great show. I think you're going to like it. They're even bringing on one of their patients to share a very touching story about his turnaround. So stick around, my friends. Hope you enjoy the show. You know, as we strive to be happy and succeed in life or in business, many of us develop these emotional roadblocks and obstacles, and sometimes they're pretty darn tough to get over. Today, we are going to be talking about that, and we're going to be talking about we're talking with a few women that have developed this really unique approach right here in Sacramento. It's actually up in El Dorado Hills. Dr. Tasnim Khan and Dr. Ayla Ahmad are here with one of their clients, and we're going to be talking about their business. It's called ShaMynds, but we're going to be diving in kind of to the product a little bit. I want to know, what led you to this, and so maybe I'll start with you, Tasnim. What's the big problem you're solving, and what led you to this? Because you've got an extensive background in medical.
Yes, Mark. So thanks for having us on the show, by the way. We're really excited to be here. Well, I wish I could just give you the sort of the abbreviated, abridged version, and I will try. What led us to this space is really reflecting back on a 20 plus year career in medicine and going, what did I do? And, being grateful for the things I was able to do, but then realizing that, and this was especially during the pandemic, realizing that we still are continue to lose ground in the area of mental health. And the current tools that we had in our pockets and our little books and everything weren't just working. And then adding to that was my own experience with mental health, with really being in the same place where a lot of the people who come to us, are in, and really being able to, see that from inside out or outside in. And seeing what the system was giving back to me as a physician, and thinking, if this is what I'm getting, then I can't imagine what it's like being a patient who can't advocate for themselves, what it's like for them. So that's like one part, and then the other part was actually, fortuitously getting into the realm of experiencing psychedelics firsthand. So and that being the treatment, that being, of course, the legal psychedelics being ketamine right now, really being something where I came out of the experience and went, oh my God, like what have I been doing all these years? And, how do you get this out to as many people as possible? How do we do that? Because it's not doesn't currently live in the current model of care and model of the sort of the insurance payer world. So how do we get this out? And so that led to the birth of ShaMynds in Sacramento.
So what's the name mean? Remind me of the name ShaMynds, MYNDS,
Oh, well, I have to speak with a little humility around it because I'll come back to that.
Okay.
So it's actually, the credit goes to my 11-year-old nephew, who we were sitting around one day and going, well, what do you think? What do you think? How do we be respectful of the traditional sort of non-medicine, more of the spiritual nature of what we're trying to do and where our mind is right now, and blend that with medicine? And my 11-year-old nephew, he said, well, how about ShaMynds? And we're like, what are you talking about? But when you think about it and break it down, it's the shamanic mindset, the shaman, and we're not claiming to be shamans at all, but a shaman is a traditional healer in the sort of even the curandero culture around psychedelics. And so having that shamanic mindset of being able to expand your mind to be a healing presence within yourself and a healing presence to others. And so to being able to facilitate that and give people that resource back. So we kind of put the shamanic mindset to what people have in themselves, which is called the inner healing intelligence. Mm-hmm. Is you all have your own inner healing intelligence. You can do this on your, through your own power. And so that's the sha part. And the mind, of course, the little play on the why, which is, the new way of doing things nowadays, but, just the mind.
Yes.
Yeah.
So the answers are inside of us. The truth is inside of us somewhere if we can discover it. So we're joined by a couple other guests here. Ayla, you are hands-on in the business. You're running the business. How did you two pair up for this endeavor?
Well, that's a hard question to answer. That's a good question to ask. Both Dr. Khan and I are part and parcel of this business and have really come together, as she mentioned, through our own healing work. But I also have to add that a lot of things that we both have struggled with in our 20-year career medicine work, whether it be academics, whether it be in the community, whether it be in private spaces, in private health care, as well as in global work, because we've both been overseas together, so we've known each other for many, many years. Many, many, many years.
That's helpful in business partners.
It is. But also we've seen, for me, the understanding of what we're not doing, what we need to be doing in terms of healing people, the art
as
of
a
healing.
society,
as a society, as physicians, we're not able to get to root cause. And so with this opportunity with medicine and ketamine and sort of legal kind of psychedelic medicine, we're getting to root cause. We're getting to help people, not from a system-based approach, which is what you're taught in medicine. You're taught, as we were talking about at one point, about being a problem, like patients are seen as a problem. You are a problem list. But really getting to know who people are and their story and their life and what they struggled with, and then talking to illness, and then asking about how are those two connected, and how is that we can work through that to elicit healing. And we call ourselves, we're not a clinic, we're a healing center. And that's very, very, very directed, because it's not a clinical space, it's a healing space. It's a place where some people can come. People can enter in a place that feels safe, secure, therapeutic, as well as we're practicing medicine, with ketamine-assisted therapists, guides, healers, all on board doing the same thing for the same purpose.
Does ketamine need to be prescribed by a doctor? Okay.
Yes, it does. It is a medication. It is administered in hospitals and short stay procedures. It's been used for many, many years. But yes, it is a Schedule 3 drug. It does need to be administered safely, and with all the support around that, with all the medical, evaluation around that by doctors.
And what kind of people? So, a large percentage of people have these blocks, or that's what I'm calling it, and end up wanting to get treatment for it. Do you have any statistics around how many of us seek treatment eventually in our lives? Ballpark?
Well, most recent post-pandemic statistics across the U.S. is that 1 in 4 people, so it's 25% of our general, surveyed population will experience, a moderate to severe episode of mental health issues in their lifetime. So that's, across all age. I think the ages are 16 and above. So it's pretty significant. Dr. Ahmad would know more about the pediatric side, but it's pretty significant. I mean, and this is just, what we know and the people who present, and there are a lot of people out there who don't, who
won't really publicly admit it, and they're like myself, I haven't gone and sought treatment, but everybody has stuff that they deal with. So I'm wondering, like, what percentage of the people of that remaining 75 actually won't admit it, and so they don't do anything about it. They just sort of live with whatever it is.
They do, and they subsist in that space, and that's challenging.
Yeah, and I think what the questions that we know the numbers, right? There's lots of numbers out there. 1 in 5, 1 in 3. The suicide rates are up, since pandemic, and this is increasing again in our adolescent, young adult age group as well. The real question is, though, yes, that's a problem, but the real question is, how do we really address that? Why is that the case? And how is that happening? And how it affects the body. And that's the question that we don't ask in medicine, is like, you go in for a headache, but why do you really have a headache? I mean, we can write a prescription and we can say, yes, this is the medication to take for your headache. But what don't we ask about that? Why is it
we
there?
We might be able to fix a number of these things without drugs, just by getting in touch with ourselves.
And that's why our approach is holistic. Our approach is understanding people as they live, and what they're eating, how they're sleeping, how they're, who's in their home, and what's happening in their home, their story, their narrative, their spirituality, even their, who they are.
At the root of the problem, though, I should say this more naively, is, we have the big prescription drug manufacturers. They want to sell their stuff. And then we have doctors and hospitals run by corporations, and they need to turn a profit or survive. And so they've got to crank through and do the sort of best practices as quickly as possible. That's my take. When if I go to the doctor, you're kind of you're shuffled in and out.
Yeah, said the right word, cranking through. Yeah. Why do we have to even cranking through? And how is that really helping health? That's kind of the question that we should all be asking. Why do I have to crank through? Why can't I be given more time? 30 minutes, 40 minutes,
just to somebody,
to talk.
Ask some questions.
Right.
Well, you brought along with you Scott Smith. He's one of your clients. Let's get to know Scott a little bit. And, I think it's, first of all, I want to congratulate you or say thank you for you coming in and offering to share your story. You said there's no question off limits. So maybe I'll just have you start by what made you walk in the door over at ShaMynds.
Yeah, right on. I tried. I've had OCD for my whole life. I've been in treatment for that for the past 10 years. During the pandemic, I really sunk into depression. And it was moderate for maybe the first year, and then the second year it was severe. I went through a divorce, and I tried everything. I was already in individual therapy. I'm in a support group for OCD that meets biweekly. I tried transcranial magnetic stimulation. I tried all of the standard SSRIs and that are usually prescribed. Tried a tricyclic. And just nothing.
And where did you go to get those? You just went to a psychiatrist or your normal doctor?
Psychiatrist, okay. Yeah.
And then they did everything they could for you. But so what was the experience there? Did you feel shuffled out like I was mentioning?
Yeah, it does. That was the vast difference between my experience at ShaMynds and other experiences, was that you felt like a number, or like Dr. Ahmad said, a problem, and there was not really this taking into the whole picture of you as a person.
I'm not super familiar with OCD. I've heard that term, and but can you, like, what did that look like for you?
Okay. Yeah.
Because I can imagine, I've heard people really want to wash their hands a lot, and I can imagine during a pandemic, like, oh gosh, I'm fearful of germs or something.
That's a good question. Yeah, I did have a little bit of a spike in symptoms, contamination type.
Okay.
And compulsions around that, but that wasn't too much for me. In general, historically, my OCD has been around scrupulosity, which is around responsibility, morality, and just getting caught up in compulsions around checking to make sure that I was following those
around
rules.
Doing moral things.
Yeah, around religiosity and things like that.
Give me so you're using, I'm the C student around here, so maybe just give me a situation.
Okay.
Like, this is the type of thing that happens.
All right, just like on a basic day, like if I opened up my car door and I had a thought in my head that I hit somebody else's car door with it, I would be there for maybe 5 to 15 minutes. I might even come back to check and make sure that I didn't mark that car door. Oh. So there's like, there's maybe, I made a list when I first went into treatment with that, and there was, maybe 100 different compulsions that I performed that were all around just trying to alleviate this anxiety by performing the compulsion, but then it just fuels the fire. It's a self-fueling
So around
system.
Being a good person, really.
Yeah.
Okay, so you walk in the door. Walk me through the experience, because I have never tried ketamine. I've never done that. But what happens to you throughout this process?
Well, I mean, first, like, they do a really good job of getting my background and incorporating therapy. So they really prepared me for it. So when I went in, I had a therapist at ShaMynds who set me up for it, does a pre-administration of the medicine and goes through what your goals are that day, your intentions. Then the medicine is administered, and afterwards we talk about what has happened. And
it's administered intravenously, though. So you're in a chair, comfortable setting, and then
That's right.
You got a needle in you. You're getting something. You're getting an IV. Is that
IV
right?
or IM, either.
Yeah, and then how long does it take?
The
treatment?
It was about an hour.
About an hour. So you're sitting in a chair, getting put some fluids in you, and what's the feeling? What does it feel like?
Well, that's really hard to describe, but I mean, it was different each time too. It felt, sometimes it felt wonderful, it felt blissful, and other times it felt like work. It felt there was some. But they were both types of experiences were valuable. There was something to take from them.
Did you kind of go out? Almost like semi-conscious?
Yeah, I knew where I was and I knew what was happening, but this is why they call it ineffable. It's hard to describe.
Okay.
And I felt like it was a place for me to be in an observer role of my thoughts and and what's
kind of
going
like
on
outside of your body at some level.
You could maybe describe it that way, but I just felt like I could observe what was going on in my brain. I was kind of set some distance between my thoughts and my feelings, so I wasn't so just enmeshed with them. And in that space, I could actually work on applying tools that I learned in therapy. So it felt almost like sometimes it felt like it was like a massage, like a soul massage. And then other times it felt like I was at a gym working on my mind.
When you're going through, so you're under the influence for this hour or so, and then you're doing the work or getting the work done to you, the massage, are people talking to you, or are you just working in your own mind of things you already know from the training?
Yeah, we have yes and no.
Okay.
Yes, we have headphones on for music. The music kind of they call it the third therapist, and it kind of guides the journey a bit. And I have eye shades on, and if I need interaction, someone is there for me. If I need support, they're there for me. But generally, it's if everything is going fine and I don't need anything else, I'm just quiet and experiencing it.
And then in terms of working on yourself, were you asking yourself questions?
Yeah, I met up. There's I met up with I say met up, but there's you feel like you meet up with things, parts of yourself and parts of your brain. I felt like I met up with the inner critic in my head, and so learning how to deal with having an opportunity to deal with that part of my brain with some distance and some space was very helpful.
Did you discover where that inner critic came from?
Oh,
Was that a relationship from early days?
I mean, not a specific source of it, but I mean, there are,
We all have, our parents and our people.
Right.
Events happen to us as kids, and it's like
Right.
it always affected you.
Right.
It affected me. I mean,
right.
Wow.
And the other part that it gave me access to was like self-compassion. Before this experience, I would just think, man, I'm really messed up. And then after this experience, I was able to be like, oh, you've got some stuff going on. But it was more of a compassionate way. Like I feel like I've had more compassion for myself since I started this treatment than I have my entire life combined.
Yeah. Give yourself a break.
Just so much judgment attached with the OCD, so much, and the depression.
So it didn't cure the OCD, but it's put you in a position to sort of deal with it constructively. Is that a fair statement?
It lowered the volume on everything. So it lowered the volume on the OCD, it lowered the volume on the depression and the critic, and there was just space for me to actually apply tools. I feel like it gave me access to tools that I'd already had and already been given through therapy, but now I had access to it because it created some distance from those voices, if you know.
How typical is this story? Because OCD, I don't hear as much about that. I hear a lot about depression. We deal with veterans a lot that come back from seeing some tough stuff in Afghanistan or Iraq, and they come back and they've got PTS, and there's a lot of suicides in that community. So I hear about that one often because I'm involved in it. But what is there a typical story or a typical discovery?
I think we really come from our approach is that everybody is so unique, that everybody's experience, what they come forth with is definitely very unique. Their responses to their experiences of the past and the current are unique. And now I'm saying that, and I'll also say there is a lot of commonality where we do see that, anything from early childhood experiences, experiences through life that could be called, I put in quotations, traumatic, but truly are traumatic, and how somebody is able to cope with them or is able to, manage them are very similar, I think, in ways. Is did they have the tools, or are they so, surrounded by that, I'm going to use the word inner critic, that they're not able to access those. They're so distanced from them. And so, yes, and then, so that can be very similar. So we do see that where they've got the tools, it's there, but, they're just not able to get past the barrier of what's kind of built up over years to then, get to where they can heal. So we do see that, and I really believe that's really how the ketamine, allows them, kind of like what Scott described, is to sort of go, okay, hold on a minute, let me just get out of this emotional spiral that I'm usually accustomed to going down into, or reliving the trauma of whatever that might be, but I can now distance myself and go back and access that. So we do see a lot of that disconnect, that's part of the healing process. So,
and I'd also like to add to what you said about all of us. I mean, I call it the bus stop. We call it the bus stop of trauma. That we all meet at the bus stop of trauma. Trauma is, everyone has trauma at some level. The complexity of that trauma varies. The story varies. Definitely there's but there's a lot of trauma that happens to the body. And understanding that effect on the body is where healing begins, and where we can access healing. So if we're talking about people coming in with hypertension, well, why are they hypertensive again?
Okay.
And where does that really begin? It began when they started getting nervous, when they started getting anxious, when they started not eating well, when they started not working with their nervous system. And that's what happens to trauma with trauma, is the effect on a dysregulated nervous system as it gets more and more dysregulated. So we're working with a medicine that allows for healing to begin at the nervous system level, to reset the nervous system, to allow for regulation of the nervous system with therapy, though. Mm-hmm. And that's how we affect or treat that very problem, which we call PTSD, which we call depression, which we call anxiety, which we call panic. That's the dysregulated nervous system effect from something that happened to people as they grow, or even in utero. I mean, things happen even before we're born. And we're learning this and we're seeing this.
Before we're born?
Before we're born.
That's early.
So epigenetically.
Is that like when we're in our mother's womb?
Yes.
Is that okay?
Yes.
It's happening to us there.
Dysregulation happens, yes.
Wow.
Why wouldn't it?
I don't know.
How is the mother and the child so connected? They're so connected. Yeah. They're sharing DNA. They're sharing a nervous system. It begins there.
Is there any part of it that's genetic versus, affected by maybe what happened to the woman while she was pregnant?
Yeah.
Okay.
Of course.
So some of it's genetic.
There's a genetic factor.
Because I've seen it run in families, but I didn't know how much that's genetics versus, nature.
I think there's, we've always, like when we do our medical histories, we'd always say, is there a family history of bipolar? Is there a family history of OCD? And it's helpful to ask that, but it's really hard to kind of tie that to XYZ gene. Mm-hmm. It's sometimes certain behavioral adaptations run in families. Certain traumatic experiences run in families, and ways to cope or not cope with them run in families. So it might be like, well, my sister has this, so I have it too. Right. Well, no, maybe it was more or less the milieu of your life, that it's not really a genetic thing. It's not on chromosome 15, gene PZY, whatever. It's this. However, as I say that, I'm full of dichotomies today, aren't I? I will say that there is the whole realm of epigenetics. There are certain called SNP protocols. These are short nucleotide sequences that do relate to propensity of mood and behavior to certain circumstances, but don't really immediately take you down the alley of, oh my God, you've got this. You're going to be depressed the rest of your life.
Yeah.
They're
people are self-medicating too, right? So we talk about, there's a stigma around maybe going to a psychiatrist or admitting it, but we all have our little vices, I suppose, the way we cope, our coping mechanism. Maybe it could be drinking or some other drugs or something like that. I mean, so I would imagine that's what some of the symptoms look like when you don't handle it.
So 50% of the population are functional substance users, right? I mean, whatever substance you want to use, I'll apply that to. That's a big number that are functional. So, they're doing their job, they're getting the things done, they're successful, and yet they have dysfunction in their life for a need for coping. I mean, that's
is ketamine or this kind of therapy an avenue to help with addiction to alcohol or whatever crutch you're using to get through your life?
Yes, it is.
Yes, it is. I mean, I think the studies they're more and more emerging with using ketamine, with using even hopefully soon to be approved MDMA, and even psilocybin, and even some of the other psychedelics, including ibogaine and. I'm just like saying these names to you right now, but there is
a second, because I mean, realistically, when something becomes legal, all of a sudden it's okay. We'll talk about it on the radio, or whatever, right? It's like, oh, it's legal, no problem. Is if it's illegal, well then, hey, it's taboo, it's bad boy, Mark, don't get involved.
Got to go to Mexico.
MDMA or whatever. It's like that's wrong. It's interesting how society has put these stigmas on us that make us sort of prove right and wrong. And as soon as it's legal, it seems right. It seems okay. Cannabis is okay. It used to be when I was a kid, don't smoke pot. Right now, it's okay. It's weird. So the next one on the horizon, right? So these psychedelics and these therapies that are illegal now. You mentioned a couple, psilocybin and MDMA. What's first between those two, you think?
Well, phase 3 trials on MDMA are also known as Molly and ecstasy, but in its pure form of MDMA in a therapeutic setting. Phase 3 trials are completing by the end of October this year. And if all goes well and the FDA gives us the thumbs up, then by next year, that would add another, treatment modality to what we can do. Okay. So, yes. And then...
But I can go get that stuff on the black market.
Sure.
Now, I mean, I was on a podcast the other day, or listening to a podcast the other day. It was about health and fitness, and they're talking about this stuff like it's helps my performance. I become a better skier when I'm, I got just a little microdose or something, and it's stuff that's like I had no idea this stuff existed until the last year or two when COVID hit. I turned to listening to health, how to improve my health as well.
Yeah. Well, there's a lot out there on, especially because we're in Silicon Valley, and, there's a lot that's even been published by, Dr. Fadiman on microdosing. And so we hear a lot of people microdosing, microdosing this, microdosing that.
Is that legal in California? Or is that legal or is that illegal?
Well,
microdosing like MDMA. Is that legal?
Well, certain counties it's decriminalized in certain ways. And so,
you can get your hands on it pretty easy, it sounds like. I never have, but it's like, I assume it is pretty easy. Are there some states that are like, we're pretty, like California's liberal. Obviously, we've got marijuana's legal, cannabis is legal now. Are there certain states that are going to prohibit this, but California is more lenient?
Yeah, I'm going to try my best to give you that information and as up to date as possible. But I know that Oregon and Colorado are kind of leading the country in at least setting up the right structures. A lot has been learned from the cannabis, trade. And I think that they're taking that kind of material and those kinds of policies and even observing what has happened after the cannabis rollout and kind of putting that into, policies that will promote well-being. And my greatest hope is that will not limit access. So they're out there, and Oregon is, I would say Oregon is, with the Oregon Psilocybin Health Authority, I think they're really leading the way on that. And it is decriminalized, of course, in Oregon, but here we are in California, and I think California is, actually there was just a bill on the floor at the Senate on August 3rd. I don't know what the outcome was, but it was SB 519, which is the decriminalization of a range of psychedelics in California, and that's Senator Scott Wiener.
Okay.
So I don't know. I've been like Googling every day to see what happened, but I haven't heard anything.
You bring up a good point about legal versus underground or above ground. I mean, as physicians, we have to be mindful and follow, guidelines recommended. Are what is effective, what is clinically safe and therapeutic in a therapeutic setting. So when we're talking about doing substances or having people do treatments, really providing it in a safe and effective manner is most important, and how that's done is important. Access to these medicines as they come on board will be the next type of medicine. I had trouble with the word psychedelic when we first started talking about psychedelics. I felt it was such a loaded term. It has so many meanings, and people have a visual of that psychedelic, what that means. For me, I had to really investigate the source of that word. And it comes from Latin, Greek, mind manifesting, working on the mind, working with the mind. And the mind is not separate from the body, and the body is not separate from the mind. And then don't forget the spirit and the soul, right? Because that comes into the psyche, the word psyche. So all those things are where we're talking in terms of healing. We're talking about putting those all together into a word that has meaning, that has substance, that has effect. And that's where we're we're seeing the evidence.
Have any of you tried anything other than the ketamine? That's more. You kind of mentioned that you had tried some stuff. Oh, don't ask you on public radio.
I have a nice medical license. For the medical board. I mean, in other settings, you know, yes. And I think that there's just tremendous healing potential. But I really want to emphasize the fact that, and go back to what you said, everything, you can just go get it. Yes, you can. I mean, my kids come joke with me and they go, Mom, you can get this and get that. I'm like, go try it. It's not about the drug. It's not about the molecule. It's about the what we call the set and the setting. It's about your mindset. It's the space you're in. It's where you're at, where you want to go. It's being mindful of what you want to do with this medicine. It's being respectful of the medicine. It's being, and recognizing that you are going to use this as a vehicle to do work, to grow, to heal. But, there are other settings where these things are used. And I think that's the humility draw for us as physicians. It's like, well, it's not, like I tell patients, well, it's not the medicine. They're, oh, thank you, doctor. I'm like, it's not me. It's not the ketamine. It's really the whole experience. And I think, Scott, if you wanted to speak to
that's
that.
why I chose, like when I researched where to go, I mean, I know I could get it through the mail. There's mail order ones I could get it. I think, it's becoming more mainstream. I could get it soon through even like Kaiser, but I wanted to have something that incorporated this holistic approach. That's something I don't want to just be given another medicine and say you're cured and not be cured. Like this is what's been going on for me for so long. And I wanted to have this support of therapy, of being treated like a person, being treated with warmth and care, and being seen as a whole person. And so, I mean, that's a huge part of what was healing for me, was those components, not just the medicine.
How's it changed your life?
Oh my gosh. So, I mean, I was in severe depression for about the last year, and I mean, I was hardly even getting off the couch. I was having a lot of suicidal ideation, maybe between like 15 to 100 suicidal thoughts a day.
Oh my goodness.
And I was not as good. I was more distant from my children. And after the first session, which was, I think, like 2 months ago, I've had, I think, 3 suicidal thoughts total in the last 2 months, and I was having 15 to 100 every day, and that was just after one session.
You throughout the day.
Yeah. So I mean, just that alone was, empowering. But it's just, like I said, it's opened up the access to these tools that I've been working on for so long. It's opened up tools to just thought diffusion, to mindfulness, to just working out of my values, making decisions out of my values. And it gives me this. It gave me this sense that I can actually change my mind. I don't need to be stuck in these old patterns, and it seemed possible to get out of those old patterns. And we've been calling it Scott Point 2.0 because it feels like I've got this new operating system, or this rebooted operating system. And it's life-changing. One of the reasons I wanted to talk today too was that this weekend a close family member committed suicide, and I just want people to know that there's other options out there that were really, really effective for me in reducing that dramatically.
Oh, I'm so sorry, and I know we are helping people today as they contemplate their journey. Jacob Azevedo, good buddy of mine, and we all know, he wanted me to ask a couple of questions, and I think that Jacob, a lot of our audience is going to want to know this. What's the future of care around mental health look like if you were to pull out the crystal ball?
Oh, I like crystal balls because because they're fun, because you can imagine a beautiful state. Yeah, I think that, reflecting back on the field of psychiatry, now I have to add, I'm not a psychiatrist, so people out there, but I've been buried in mental health as a doctor for many years. But reflecting back on, the first time being trained, when I finished residency training, we had amitriptyline. And then I was so excited when Prozac came along. I was like, yes, we're going to throw Prozac into the water supply. And then going, oh my God, nothing works. Dial this, dial that, up this, up that. It's been just 2 decades of very minimally effective tools. Now you switch this paradigm and you have these new capabilities, which have to be approached with a lot of respect and restraint. Good restraint is these new drugs that are going to allow people to access their own ability, less reliant on going, oh my God, I need somebody to do this for me. No, you can do this. We are here to facilitate. We are here to support. And so I think that is going to be, part of that big vision is where, as doctors, we're going to, we will be changing our approach and giving that power back to patients and saying, here, you go. This is you. I'm here to support you. And then I think the whole field of holistic health, of what Dr. Ahmad was just talking about, was mind and body, getting away from this idea that it's all up here. What else is happening in your gut with your exposure to environmental toxicities and wellness? Oh, let's ignore that. No, we're going to be bringing that back, and that's the crystal ball vision, is looking at people as a whole, using that integrative approach, using that, total holism with a W approach as the whole individual, and saying, this is you. This is how you can do what are the things you can do to sustain? And we've got so many more, and Jacob knows this because I talked to him about it, is, there's so much more on the forefront that, of course, is not covered by insurance because that's not how insurance works. But there are so many more modalities that are coming forth which will allow people to access that wellness approach instead of sickness approach. So how can I be well? How can I stay well mentally, physically, as a whole organism? And so there's so many exciting things coming along, and part of that vision will be, us doctors, participating in that, and knowing that we may look a little risque to our traditional doctor colleagues to say, no, we're going to look at this because we understand that the data that's been presented to us all these years is a little tainted. It's a little, it's big pharma. And we've followed that tune to a degree. We've seen that it didn't translate into good things, but then there's this other realm of healthcare that we can look into. We can understand the anecdotal evidence, and we can really help people access those. So I hope that made sense.
I mean, well, what's the longer term vision for the company, right? You guys have started out in El Dorado Hills. It's brick and mortar, so you walk in and get your treatment and get that healing experience. What are you looking at in terms of helping more and more people through growth?
Yeah, that is one of our goals. I think moving forward is how do we expand.
Can I just say we're hoping to be in El Dorado Hills?
Yes.
Oh,
we are in Midtown Sacramento.
Oh, you're in Midtown Sacramento. Oh, okay. I thought you were in El Dorado. I know you live out that way. Yeah. Okay. I thought I haven't been in it.
Yeah.
Okay, so you're in Midtown. Okay.
Yeah.
That seems like a good location.
It's a good location.
Yeah, we're central right now to Sacramento. But yes, we are looking to expand, of course. We do get a lot of phone calls. We get a lot of people looking and searching on Google and just for help. So having access in a way that's novel, that's a way that's accessible. I mean, we have the opportunity with telehealth to do visits as well as care. And again, being very, very mindful of giving time to each person, even as we expand in this growth. We're seeing that we're getting a lot of people coming to us who are healers themselves and who are struggling themselves as we did, and I call myself a wounded healer because we have all kind of gone through that journey and healing and then realized, oh my God, I need some healing too. So we're seeing that My vision, if I had a crystal ball, is that we change the way we teach medicine, because I'm a professor too, so I like to teach. But we change the way we look at people. We're not going to be looking at people as a problem list. We're going to be looking at people as who they are and approach it that way. And then we, people who are coming to us are the healers themselves. They heal each other. They heal their families. They heal their children. They work with that. They learn the art of living, essentially. And noticing, like Scott was talking about, the observer, being an observer of oneself. That's big. That is so big when you can be an observer of yourself in a very compassionate way. That itself is healing. And so when we can do that in real time with our relationships, with our children, with our parents, with our, with our friends and family, when we can just allow ourselves that ability to observe and reflect, then we get to, working with that person who's anxious in a social setting, So it's the art of healing that translates to one person to another, to another, to another. And that's my vision, or our
Heal
vision.
communities.
Heal community. Yeah. And so, yes, being accessible is important. Expanding this idea is important. Changing the way we deliver and access medicine as healers and as people coming for healing is important. And there's so much opportunity with that. Scott also mentioned music. One of my visions, or our visions in our center, is music is how do we get the healing aspect of the therapist, which is the third therapist, is music, which we use in our sessions to engage in that journey experience and help people navigate through that experience while they're in the medicine, and then using that at home for healing purposes. And because there's so much science behind the effect of music on the brain, the therapeutic benefits of allowing that reset to happen restoratively while even sleeping, because everybody has a psychedelic experience at night. Everybody dreams, and that's a psychedelic experience. And that's why we need to dream. And if we can get to that restorative state with other treatments outside of our center, that's an opportunity to heal.
Scott, what's your longer-term vision?
My longer-term vision for myself?
For yourself. Your outlook has had to have changed, right? You've made this incredible progress. You're coming on our show to help others. What do you see for the future for you?
Yeah, I would love to get involved in this kind of work. It was so beneficial for me. But beyond that, just in my daily life, it has impacted me so much. And what Dr. Ahmad was saying too, like being in that observer role, it feels like having that experience is so translatable to daily life, and that having that kind of anchors you, and you can kind of go back and draw on it. And it's really been powerful. I mean, I just traveled to see family for 2 weeks. I haven't seen my family in 4 years, and during the Depression, there's no way I was even going to go anywhere. And it was on 9 different flights. And I enjoyed it. I was able to be in that observer role and just not be so entangled with every thought and every feeling that comes up, and not be entangled with like old wounds or old disagreements with family members, but having some distance, and it's just been really applicable.
Well, we only have about a minute left, but I want to thank you all for coming on the show. But just what question did I not ask that I should have asked to kind of help give our audience a broader perspective on how to heal themselves?
Well, you asked all the questions, and we have so much more to say. I wish there was a part 2 and a part 3 to this. Mm-hmm. I think that you asked the question about scale, which, I guess your podcast to entrepreneurs and people, they want to hear the things. I think it's important to say that we are in this kind of this inflection point in the realm of psychedelic medicine, where we really need to maintain humility and respect for what we're doing. We need to respect the people and the needs of the people that are coming to us, and not go full scale into this model of healthcare, which, yeah, sure, I'm an early adopter of lots of technology, but if we get technology and if we get that remoteness back into this, this is my theory, is it loses that human element. And I know people talk about brick and mortar businesses and how brick and mortar businesses are like this and like that. And like, yeah, sure, I know. But, you know, you need to have that human touch. You need to, you know, we've gone through so much effort to recruit a team of people who are there to love, to hold. They come with a lot of skill and expertise. They're not perfect, but they're there for that person. And so if we start to like build these scalable models and we neglect that, and we neglect the needs of people as they come to us as human beings, then I think we'll lose ground in this space. So scalability will have to come with that unrealistic vision of, you know, 4 walls right now for us. That's our vision, is like, well, we have to do that because we're going to stay committed to that, even though it costs us more money, but we're going to do it. We're not going to, you know, we're going to increase access, but we're going to do it with that in mind.
That quality of care.
And I feel creativity cannot be discounted. I think creativity in this work and working outside the box too, you know, thinking about other ways to heal. It doesn't have to, medicine isn't, the ketamine-assisted psychotherapy is vital. You know, talking about your nutrition, you know, there are other ways to increase healing outside of the brick and mortar as well, but with a creative mind. And the mind of the shaman, I think, and honoring the history of medicine as we've known it from all parts of the world, right? I mean, there's so much to be learned from traditional Chinese medicine, the Ayurvedic traditions, incorporating that. Why are we ignoring 3,000 or 4,000 years of history of medicine when there's evidence to that too? And I'm speaking from a clinical point of view, Western trained provider. I'm speaking from that. And having now going back and opening up the books to research those things is incredible. It's incredible eye-opening experience. So why not be creative with that and build that into health as well?
Well, thank you, doctors and Scott, for coming on the show and sharing your story.
Thanks for having us.
Yeah, we really appreciate it.
Thank you.
Welcome back to the Mark Haney Show. Learned a little bit today. Was touched by Scott Smith's vulnerability to come on a show and really share with the world what he has been going through. And just a thank you to the doctors for helping develop this approach that a lot of us are probably unaware of and maybe even dismissive of at some level, but when you understand it better, I think it can be very eye-opening, and that's what happened for me today. So thank you all for coming on the show, and just a shout out to everybody out there that's going through the battle in entrepreneurship. I mean, it is a stressful thing, and we need to be at our very best. And so all you out there, battling and working to fight the good fight for entrepreneurship, you know that I love you. And of course, all you out there fighting the good fight for our freedom, our security, and our way of life. We're never above you. We're never below you. We're always by your side.
Thanks for watching today's show. My goal for every episode is that you find a takeaway, something tangible you can use in your business today. And if you have a comment about a favorite takeaway, feel free to put it in the box below. And if you have a topic that you'd like me to bring up on the show, don't forget to let me know. And also, don't forget to subscribe to our YouTube channel if you want to learn more about entrepreneurship. Because at Haney Biz, we are always by your side.